Welcome back to HealthWise with Dr. Lewis Mess with Plastic Surgery and Associates. Dr. Mess, we're going to talk a little bit now, I guess, about breast enlargement. We talked about breast reduction. I know the big worry now is silicone. You know, everybody is like, man, you get those and they just, you know, they leak. You end up with, well, that's what they say. That's what the people say. What's your take on that?
Well, I'm glad we can talk about this because it's important. Back in the 80s, silicone and implants got a really bad rap, and to some extent that was deserved. But, you know, the analogy I make for my patients and I make for the audience now, which I think most people can understand if they're old enough, is Firestone tires. You know, we had a problem with, or Firestone had a problem with these tires popping and cars turning over and so on. Now, that was a tire problem. It wasn't a rubber problem.
Right.
And what we had back in the 80s were implant problems because there was a lot of experimenting going on with different designs of implants, and they were rupturing and silicone was getting loose. But the problem was the fact that we had a foreign body that was in there that shouldn't be there, and we were messing with Mother Nature. It wasn't really a silicone problem in and of itself.
Okay.
So all the diseases that silicone was supposed to cause really were not being caused by silicone. And the problem was that we as plastic surgeons hadn't done our homework properly and we couldn't prove things, and so it got in the courts. Now, 20 years later, we can prove all this and people will realize it's all gone away because there never really was a problem with silicone. Our problem was with, if you like, poorly designed implants. And we got new ones now that are on the market, so-called gummy bears or memory gel, whatever you want to talk about, that do not do that. They've turned the silicone into a jello type of consistency now rather than that liquid. Okay. And so if the implant breaks, it just sits there.
Okay.
And
what about, I know there's even saline, you know.
Saline implants have a silicone shell, and that, of course, there's no problem with the silicone there. If they break, then they just go flat, and they have to be replaced. You know, any implant that breaks needs to be replaced, but there's no risk to the patient. You know, if a girl has had a breast enlargement and her implant ruptures, we joke about it. It's not really a joke, but it's more of a social emergency rather than a medical emergency. She just needs to have it taken care of, and it's a fairly minor procedure to take care of those. So
on breast enlargements, is it done outpatient?
Yeah, we do those outpatient. The patient comes on in, we do the surgery, they go on home, and then they see us a few days later. It's fairly painful to have a breast enlargement if you go behind the muscle with the implant, but with pain medicine and proper management, most people do just fine, and within a few days they pretty much back to relatively normal activity. Okay.
Well, like I said, I know a lot of people are interested in that, but once again, it is an operation, it is a medical procedure.
Shop around in the community and find someone that is respected, and then go to that doc, and don't be scared to ask about his credentials.
Right, and what should they look for in those credentials? What should they?
Board certified in plastic surgery. For heaven's sake, the plastic surgery part. If you're going to have a hip replacement, orthopedic surgery. If you're going to have your eyes done, ophthalmology. You know, if you're going to have your sinuses done, ear, nose, and throat. But if you're going to have plastic surgery, board certified in what? In plastic surgery.
Okay, so make sure you get that.
Yeah.
Make sure they're board certified in plastic surgery. And should they ask for references?
If they want to, that's fine. And the doc should not be embarrassed about doing that. If the doc hedges about, references are a little touchy because of privacy.
Right.
But qualifications and things like that, no problem. Ask to see pictures. Most doctors will keep a file of before and afters, and they'll have permission from their patients to use those pictures.
That's a good. I know dental wise, that's what a lot of times when you go to dentists now, they'll show before and after pictures of smiles. Sure. So,
but you can get your own references if you ask around. You know, I mean, if you ask a friend who you know has had breast surgery and he said, go to Dr. Mess, for instance, because I like him, that's a good reference. You know, if she comes to me and says, who would you refer to? Then I can't really tell her about her friend because the friend hasn't given me permission to do that, you know.
Right, privacy. But I mean, it seems like I said, it's just, you need to do your homework.
That's correct, absolutely.
That's the basic thing, do your homework. Well, Doc, like I said, I can see we're running out of time, and it was nice having you on HealthWise.
It's been my pleasure, thank you.
And we hope that you continue to enjoy life in Acadiana, and We already talked about the food. I know you like the food.
I surely do.
And I wish you well, and happy holidays to you.
Thank you very much.
Okay. Yeah.
HealthWise is brought to you in part by Opelousas General Health System.